Hello, I'm Dr. John White, Chief Medical Expert at Discovery Channel. Physicians and researchers at the UPMC Rehabilitation Institute are conducting brain-to-computer interface studies, investigating how patients with paralysis or amputation can control an external device, such as a computer or robotic arm, with just their thoughts. Last year, a patient moved a robotic arm in 3 dimensions using electrocorticography. Now these physician scientists are working to help patients achieve even greater control using single-unit recording. Let's learn more.
Brain-to-computer interface is a way to record the electrical activity in the brain from the firing of neurons, and then decode that activity in a way that allows us to learn what someone's thinking and then potentially control devices. We've had many achievements in the brain-computer interface area. 1 year ago, we implanted someone with electrocorticography, which is electrodes on the surface of the brain, motor cortex, enabled and then decoded their thoughts while they tried to move a robotic arm, and we were able to achieve 3 degrees of freedom control, meaning that you can actually then control a computer, a robotic arm or prosthetic arm to reach a point in space. In electrocorticography, we put electrodes on the surface of the brain and we record the electrical activity from a population of neurons. In single unit recording, we put a very small grid that has 100 penetrating electrodes that actually gets injected into the brain, and now we're recording from single neurons. You can then again decode those single units to try to achieve control. I talked about degrees of freedom. 3 degrees of freedom allows you to reach a point in space. If we're really talking about function, though, you want more degrees of freedom. And so in a paper that recently came out, we reported 7 degrees of freedom. With 7 degrees of freedom, you can actually control a robotic arm to reach to a point in space, orient a wrist, and grasp. So a patient with 100% brain control was thinking. We were recording her neuronal activity, and then that neuronal activity was being decoded and transferred through a computer and completely controlling a prosthetic limb. Through that activity, then, this particular patient was able to achieve functional tasks. And again, this is someone who was unable to move at all. So for the first time, this person was able to lift an object, move an object to a different location using all 7 degrees of freedom. We thought if we could achieve 7 degrees of freedom control in a year, we'd be happy, and we really got there in 3 months. And so we're working on 10 degrees of freedom control. When you get to 10 degrees of freedom control, you actually then can control hand movements, so different grasps. And so this experiment has really lived up to our expectations in a major way. Both technologies, electrocorticography and single unit recording, have roles in all patient populations. I think electrocorticography will be available as a clinical tool sooner. I think that when you talk about someone with severe impairments, like some of the people we've used in our studies with high-level tetraplegia, that penetrating electrodes may be a more appropriate device. And the team here that has enabled this to take place has really worked together collaboratively, and that really is the future of medicine and certainly the future of science. You can't conduct any kind of experiment like this in a vacuum of a single department, and certainly we didn't do that here. Our experimentation is always looking for volunteers. We found 2 people who had complete tetraplegia from 2 different things. One was a motor vehicle accident, the other one was an autoimmune disorder. And those patients volunteer to have elective surgery twice. They have to have it implanted and explanted, but they're really advanced in science, and I have to tell you that for both of these patients, it's been life-changing. Physicians need to know that brain-computer interfaces are providing amazing scientific information related to neurologic function and how the brain works. They also need to know that this is something that I believe will be a therapeutic option for their patients in the future, both for recovery after something like a stroke and for providing an interface for something like after a spinal cord injury.
Physicians and researchers at the UPMC Rehabilitation Institute will continue to advance brain-to-computer interface technology with the goal of developing techniques to help patients living with paralysis or amputation to achieve greater independence.
We are anonymous. We are legion. We do not forgive. We do not forget. Expect us.